everyone, and welcome to your Exam 1 review. First, you need to know and understand fetal, neonatal, maternal morbidity, mortality. So you need to know the definitions of each of these in terms of the time frames and meanings of each. So time frames meaning what's the fetal period versus the neonatal. Know and understand cultural humility and understand what is necessary with a language barrier with a patient. How would you communicate with that patient? You need to know barriers to health care. Be sure you review and understand informed consent and refusal of care. Be sure to read the Strobel article or study and the required readings about the maternal microbiome. Make sure that you review and understand the menstrual cycle and contraception. More specifically, know each phase of the menstrual cycle and what occurs and which hormones act where. Know and understand the level of reliability with all contraceptive methods. And you also want to know what each of them does, what's the function of each hormone method. Make sure you know and review all the hormones of pregnancy and their functions. Fetal monitoring and genetics. You need to understand contraction terminology, frequency, duration, intensity, and resting tone. And make sure you understand how are we documenting these, but most importantly, know the definitions. Know all interventions for fetal heart rate decelerations. Know the signs of fetal oxygenation. Think about what you would see on the fetal heart rate monitor. So what things are going to tell you that you have an oxygenated fetus? Know and understand causes of fetal heart rate decelerations. So remember your VEAL-TRAP acronym. Know fetal heart rate categories and which types of strips will go into each category. Understand the ideal time for genetic counseling and the importance of preconception counseling, particularly in women with comorbidities or advanced maternal age. So think about the woman who may have diabetes or hypertension. Understand genetic screening versus genetic testing. It's a big difference, so know which is which, and which test would you offer first to which population. Know and understand screening versus diagnostic testing for genetic defects. Diet and prenatal care, so make sure you understand maternal diet. Foods that they are to avoid, nutrients that are recommended in maternal microbiome. Again, review the Strobel article. Hormones of pregnancy, we mentioned that earlier, so know them all and what the functions are. Know the early signs of pregnancy. Know and understand the appropriate way to date early pregnancy, so we talked about this, so using the last normal menstrual period versus ultrasound dating. Know and understand Nagel's rule. You will be asked on the exam to calculate a patient's due date. Know presumptive, probable, and positive signs of pregnancy. Know and understand the prenatal labs, blood testing, timing of blood tests. Okay, so example, when do we collect group B strep swab, and what does a positive result mean? Okay, so all those prenatal labs that were in your case study that you did on early pregnancy and pre-pregnancy, you need to make sure that you know those labs. Physiologic changes and discomfort, so know all the physiologic changes of pregnancy. You need to know by which trimester they're going to have the most discomfort. Okay, so trimester by trimester. Know and understand the causes of spontaneous abortion. Know the GT-PEL system, so gravida parity. There is a practice quiz. I highly recommend that you take that quiz worth no points to see where you are, to make sure you understand that. Understand the prenatal schedule and what patients should follow up in the antepartum period. Okay, that's it. So email me and Canvas if you guys have questions. You will all do amazing. I'm thinking of doing a exam review for you guys, a Q&A on Sunday evening. I will go ahead and post in the announcements what time that will be. So I would plan on that. I should be able to do it pending if I get out of here. I'm across the country, but I will post in the announcements. But plan on Sunday evening. It's either going to be 6 o'clock or 7 o'clock. Thank you. Hello.